Okay, thanks, Peter, for that fascinating talk. Let's open it up for questions. Yes, it's Dr. Merry. Yeah, sorry, you. Yeah.
Artificial intelligence is creeping into medicine. And I want to know your comment. If artificial intelligence is used in the decision about who is to use the ICU, with artificial intelligence, you can incorporate things like physiological age, not just the calendar age, the earning power of the people, whether the old lady is looking after his grandchildren, and all these factors can put in. But then the decision come out is out of the hands of the human being.
Yes, that's a very good point. Thank you. Obviously, the ethics of using artificial intelligence is being hotly debated in a lot of contexts at the moment. But I think, and it may have disadvantages in some cases, but I think if it can be used on the basis of objective measures, as you say, physiological measures, for instance, and it can be shown to better predict the chances of survival of different patients if admitted to the ICU. I think that would remove the suspicion of personal biases and prejudices that people might have. Now, we would have to be careful about making sure that the algorithms that the AI is running on do not incorporate biases themselves. There have been some cases in quite different areas, for example, in giving people loans to buy a house, where it has been suggested that the algorithms actually were picking up irrelevant factors that introduced racial biases. So we do need to be careful. But if we could get something that demonstrably was effective in predicting the benefit that would be obtained through a particular treatment or through admission to the ICU, and we demonstrated that it achieved that benefit without having irrelevant prejudices or biases, then I would favour making use of that knowledge.
Thank you. So I was wondering, so whatever you think about the justifiability overall of the lockdowns, it seems as though the benefits and costs didn't fall to everybody equally in society. So it seems, for example, as though the benefits of the lockdowns, if there were any, generally fell to those who were more likely to die from COVID, namely those who are very old. And the drawbacks, it seems to me, were most pronounced for those who missed like super important developmental milestones, namely the very young. You might also think in terms of class, like the people who are benefiting from the lockdown, or if you are living in like a mansion or something, it's going to affect you less to stay home, whereas if you're living in a crowded HDV, it's going to affect you more. Given that, I guess I wonder what you think about the moral possibility or even necessity of imposing something like reparations post-pandemic that would go to the people who suffer disproportionately more costs, like the young people and the poor people.
So you're absolutely right about the benefits and the disadvantages were felt by different groups. I hadn't thought of providing reparations. I mean, in principle, I don't object to that, but there is a question about how you actually do that. For one thing, if you start offering financial benefits to people and you have to take their word for where they were during the lockdown or what they were suffering, you're likely to get a significant proportion of people who are essentially ripping off the system. And that's not good. Another is for some of the things that you mentioned as the greatest hardships, like missing developmental milestones, and I totally sympathise with that. I think that did happen. But can money really make up for that? maybe rather than money, you could offer services to that would help, that would give people who missed those milestones advantages, special opportunities to make up for whatever they missed, whether it was educational or social. So I think that would be good. I think, probably, yes, and perhaps in general for children who missed a lot of education, and particularly if they can be seen to be below this level that they would be expected to be at, I think that kind of trying to compensate or provide reparation would be desirable.
We should get diversity. Is there any diversity there? No? So I'll go for you next. Yep, you, yep. Oh, sorry, Alan.
Thank you. Actually, I want to follow up the previous questions. I'm from AI field. I'm studying computer science. And I actually feel that today's lecture talks about a lot of principles, changes in social conventions, actually very similar to algorithms, so that people do adjustment to different variables. So my question is that I feel there is a difference that, in the decision making, comparing computer science to the actual society, is that the time for this, firstly, I feel the world is going to more and more decentralized. So previously, people learn and hear the voice from government of, basically from newspapers, TVs are more centralized. So the government's decisions, when they made the decisions, it's easier for them to kind of broadcast their ideas to the general public. But now, using social medias, people actually learn from each other's and from what they're actually more interested in. So when there is a decision was made, it's harder for people to understand. So it takes more time for people to actually accept those kind of transformation in social conventions. So for example, the safe belt, it's easier for the government to actually persuade people to actually hold on the safety belt, because people at that time still read newspapers. But nowadays, the vaccinations, people usually, are not that trusted to government. So it's harder for people to accept those kind of changing social conventions or principles. So I think there is a conflict of interest. So from which point that you think is, can the government trying to solve this things to make people more easier to understand how the decision was making, and how, why they should obey this kind of changes in conventions. Sorry, thank you.
Yes, thank you for that comment and question. It's interesting. You do have to wonder whether if seatbelt legislation hadn't existed until now, whether it would be more difficult for governments to legislate for it because of the diversity of media that people are listening to. And even then, when it was brought in, there were some people who said, maybe you'll be in an accident where the car will catch on fire and you won't be able to release the seatbelt, and so you'll be burnt to death, whereas without the seatbelt you could have escaped. That was discussed, but obviously that's extremely rare circumstances. Don't come anywhere near to balancing the cases where the seatbelt does help you. So I don't know. It's all the diversity and the extent to which people do not listen to official or well-informed sources seems to me to be culturally variant, and I notice that because I divide my time between Australia and the United States, which you might think are relatively simple cultures, relatively similar cultures. They're both English-speaking, both have some kind of inheritance from Britain, but they're actually very different in this. So, the kind of violent attacks on Anthony Fauci that were occurring in the United States, and the proportion of people who were saying that COVID was a hoax, not getting vaccinated, the rejection of lockdowns, All that was at a much higher degree in the United States than it was in Australia. Where actually generally the lockdowns, as I said, we had quite strict lockdowns. They were quite well accepted. There was small numbers of protesters, but maybe 50 or 100 people would turn out. And most of the public supported the lockdowns and supported vaccination. So I think it's important, even with social media, to try to provide that education that people can learn to differentiate between what is a well-informed opinion and what is a crazy extremist conspiracy theory, and things that are somewhere else on the spectrum between those two things. So to me, the answer to your question is that we need to try to do that, and we need to try to get people speaking out against some of these more extreme views and showing why they're not well-founded.
Okay, so we have quite a line of questions. So if we can keep the kind of questions kind of modest in length and sort of...
and the answers too, I suppose.
Yeah, and so we'll get more people. It will be a better solution for everyone. And so also I think that Peter would be happy to field questions outside of the pandemic ethics talk. I mean, some of you will have questions about his other work that you may want to ask. I'm sure he can field some questions unprepared. But Owen, I think you were next.
Okay, thanks. I'll try to keep it brief. Yeah, so focusing on the international allocation issue, you gave what seems like a prioritarian response, focusing on low-income countries for international allocation. But I wondered what you thought about the fact that might be in tension with the utilitarian response, particularly because during the height of the pandemic, when there was a scarcity of vaccines, the deaths per capita from the virus were not concentrated in those low-income countries. They were in middle-income countries, particularly in Latin America, where there was much greater numbers of deaths per capita, and those are countries that had substantial difficulty obtaining supply of vaccines via the open market. And so if you were to allocate, just based on maybe absolute poverty or need or something, you might go for low-income countries, but save fewer lives. But if you were to allocate based on number of lives you could save with a given tranche of vaccines, you might actually go for middle-income countries. What do you thought about that potential tension?
Yeah, thank you. So I wasn't consciously taking a prioritarian position on international vaccine distribution, and it is, as a utilitarian, my views will change according to the evidence about the facts and how you save most lives. In addition to what you were saying, there was an argument that it was really important that the economies of the developed countries continued to function properly or didn't go backwards too much, because the fact that they were going backwards to some extent during the pandemic was having a highly negative effect on some low-income countries that were relying on those markets. So I suppose my view is that in the early stages, when what you were trying to distribute were the first doses of the vaccine, then yes, the people most at risk should be getting those. That was the older people. There were more older people in the developed countries than in low-income countries, and probably they were easier to reach. So it made sense to distribute the vaccine that way. But once you got to the stage where we were starting to distribute second and third doses of vaccines in developed countries, but very few people. I mean, I think at one point, I seem to remember about the time that I got I don't remember if it was my second or third dose, I saw some figures that said that only 1% of people in low-income countries had been vaccinated. And that, I think, seemed too extreme. That it was hard for me to think that it was more important for me to get that second or third dose than it was for some people to get a first dose. Now, I'm not sure, again, if you can show me evidence that that was wrong, that actually the second or third dose benefited people like me more than even a first dose benefited people in low-income countries, fine. Then I'll withdraw my criticisms of that allocation.
Okay, so there was a question,
Yeah, so I was quite sympathetic to all of your lessons, and I thought most of them didn't rely on particularly controversial moral claims, but I was a little bit worried about the risk parity bit. So in particular, it seems to me like a lot of people have the intuition that that deliberately inflicting some harm on somebody is different than like allowing somebody to take a risk of having that harm kind of happen to them in a way that isn't related to you. And it seemed to me that if you have that kind of intuition, it's not obvious that just because we allow people to take certain risks to get infected, that makes it okay for us to deliberately infect other people in order to achieve similar goods. So, we might allow, for instance, lifeguards to take a risk of drowning in order to save lives. That doesn't make it obviously the case that it's permissible for us to like drown people deliberately, even volunteers, to drown volunteers deliberately, if that would somehow, give us, research insight which would allow us to prevent drownings. And so I was worried that there was a problem, at least that you were sort of taking on some controversial moral commitments in appealing to that kind of principle. Thank you.
Yes, thank you. I know that people intuitively do draw the distinction you're talking about. It's, I suppose, it may be an example of the distinction between acts and omissions, which is something that I've written about for many years. Distinction between, it's one of the objections to voluntary euthanasia or physician assistance in dying. When it was pointed out that doctors will decide not to treat a patient who is dying where they judge that the patient's quality of life is poor, and they'll think it okay to withdraw treatment, but they will think it wrong to actually provide life-shortening treatment, intentionally provide life-shortening treatment, even if the patient requests it. My view is that intuition is a mistake. I can understand why people have it, because of the potential maybe for people to do harm, greater harm, if they don't accept that principle. But I think it's a mistake in that situation. And I'm inclined to think it is here also in the human challenge trials, and specifically, of course, because those people are informed volunteers. So even though it's true that you are acting to expose them to the virus and therefore potentially to harm them, I think that if they know that and they've agreed to it, then that shouldn't really count against it, especially, as I say, if other people are undergoing that similar kind of risk, the risk parity, as part of their duties, even though you're not causing it. So it's one of those cases where I know people have different intuitions, but I think we should be critical of our intuitions and we should focus more on the consequences of our decisions. We're making choices and decisions whether to use human challenge volunteers or not, and we should focus on the consequences of those decisions rather than on whether at some point in the process we intentionally perform an act that will harm somebody.
I'm going to just butt in here just to try to draw Peter out of his hole, because he's famously a utilitarian with very provocative views, and he hasn't really articulated the sort of, as you said, that provocative a view here. So if you look at the first principle that you started with, it was about choosing those who have the least to lose will be the ones that are consigned to death. But you didn't extend that to the other lessons. So if you thought we should apply this principle to, say, challenge studies, then we should choose volunteers who have got the least to lose. Paradoxically, that might be the elderly. It might be older people with dementia who have less happiness ahead of them. It might be comatose individuals or unconscious babies. So why not extend it to the choice of participants for challenge studies? Or to consider the sort of restriction of liberty. The vaccines were very poor at reducing transmission. The group that was most likely to benefit from the vaccines were the elderly. So why wouldn't you require selective mandates of vaccines for the elderly, or selectively lock down the elderly because they're the ones who have the most to gain. So why did this principle that was apparent in the first, or this idea of essentially maximising utility not extend throughout the argument to its full extent?
Thanks, Julian. That's what you have friends for in philosophy, to challenge you. So I was generally focusing on realistic proposals during the pandemic. I don't think that doing human challenge trials with people unable to consent, whether because of dementia or because they were comatose, was a realistic option at that time.
Selective mandates for the elderly.
Selective mandates for the elderly might have been.
Greece and Italy imposed selective fines on only the elderly for not being vaccinated. So some countries did impose selective mandates.
Yeah, that's interesting. I didn't know about the selective fines. I do know that in Sweden, which as I said, did generally not lock down the population, there was, and I'm not sure if it was mandatory or it was just pressure, there was sort of a lockdown for elderly people who, you know, they were expected not to go out and mix because they were at more risk. And I think that is, in fact, the best argument against, you know, in the practical argument, I talked about trying to weigh up the very different costs and benefits, but in practical terms, without being able to weigh up those benefits, an alternative to the lockdown was to say, let's lock down the people who are at most risk, the elderly. Sure, we'll provide them with what they need, so they won't go out to do the shopping, but we'll have people delivering the shopping to them, and a range of other things like that. And that might have worked better, actually. It's possible that would have worked better had that been put in place. So I would accept that. What were some of the other cases you challenged me with? So, you know, at least in theory, if you're talking about experimenting on people in persistent vegetative state, for example, or people who have been declared brain dead, and if you can do medical research that's beneficial on them, I think that's fine. I think that you know, you might want to get their consent beforehand if you can, as we have cards that we carry to give consent to our organs being removed if we're brain dead. But personally, I'd be very happy to have a card that said, if I'm in a persistent vegetative state and you've scanned my brain and there's no hope of me ever recovering out of this persistent vegetative state, even if I'm not brain dead, you can have my kidneys and liver and heart and all of it. They're no use to me anymore. So yeah, I would also be prepared for you to use me as a research subject. So those are more theoretical questions. I don't know whether I've answered most of the ones you threw at me.
We should pass on to the others. Well, I'm going to take one.
Thank you. It's actually a follow-up on.
Sorry, can you use the microphone?
Yeah, okay. It's actually a follow-up on the discussion you were just having. So I was wondering if the lockdown was designed to protect the elderly, then isn't it a bit paternalistic towards the elderly? I mean, I know that it sounds strange, especially in Singapore, but there are other cultures in which the elderly were complaining because those were the last years they had to live and they couldn't see their grandchildren and they couldn't see anybody and they were locked in a little flat without anyone. So in the end, I think this clashes a bit with the Mill principle. The lockdowns would have clashed a bit with the Mill principle. I don't know what you think.
Yeah, that's an interesting perspective, and certainly it's true. There were really heartrending stories of people who, I guess this is not exactly because of the lockdown, maybe it was in some cases, people who could not see sick relatives who were dying. So I suppose what you could say is, going back to what I was saying about the alternative being to lock down the elderly, you could say that they could request not being locked down, and to do that they would have to be informed about the risks that they were running, and sign a statement that they were willing to take those risks. Now, one question then would be, if they sign that statement, run those risks, get infected, do they still get admitted to the ICU? Which maybe, if we assume that the ICU is full, maybe keeps somebody out of the ICU who could have been saved by it. So I think I would be prepared to say, if they waive their right to get into the ICU, it's hard to object to allowing people to make that choice. So to that extent, I think I would agree.
So there were a cluster of questions over here. So maybe if you pick the one over on the furthest away, because he's discriminated against. So I'll come to you and say, by being geographically isolated.
Hi. So I just wanted to ask about, you mentioned about the race when leading with the vaccines. So now that the stats are in, especially in the United States, people of color usually die or get infected maybe even more than twice compared to white people. And now that we know that, maybe if another pandemic comes along, don't you think that we should allocate more vaccines when they are like in lower amounts for people of color or oppressed minorities, so that basically they don't die twice as more compared to white people? That's just my question.
Yeah, I'm not sure that I got everything you're asking, but I think my answer would be, I would still want to know what the benefits of those people are. So the fact that they've been oppressed and have had bad lives, worse lives than white people, you know, as I say, I'm not really a prioritarian would say that's a reason for giving more weight to the benefit you can give to them. So, you know, as in that slide about the 10-year benefit versus the 20-year benefit, you might weigh that benefit higher. But that's not my view. I would still want to look at how much you are benefiting people in general in a race-neutral way, rather than try to make up through the distribution of healthcare the disadvantages that people have suffered from. Now, in saying that, I should say I do want to improve the distribution of healthcare to people who are worse off, including black people in America. Because, as I said at the beginning, I think you can actually make a bigger difference with the resources by helping people who are worse off in general. So
we're almost out of time. So we will have free food and drinks. And Peter has kindly agreed to stay around, and you can approach him individually and ask your questions. But let's just take one down the front here. There's a lady here. Thanks very much. Sorry, I'm going to have to wait. I've just got the lady just here. Yeah, sorry. For the others, please approach Peter afterwards.
Not all at once, though.
Hi.
Yeah.
So I have a question about paternalism, so a little bit linked to the question earlier. So I just wanted to ask, you said that an exception that Mill made to his own objection to paternalism was that if you fully inform the person and then they still continue to make that choice. So I was just wondering, is there kind of a contradiction there? Because implicitly you would assume that in you informing that person, they would have to understand what you say and then kind of understand the risks in order to be fully informed. But what if you mentioned like there could hypothetically have been kind of an education program to inform people fully of the risks of not getting vaccinated, right? What if people refuse to take that program? Or what if people just generally refuse to become fully informed? Then you can't make them become fully informed. So is there a contradiction there? If there is, how do you break it? And if not, why not?
Thank you. It's not exactly a contradiction, but it is a question that people who are opposed to paternalism or people who favor paternalism need to ask themselves. In the debates about paternalism, some people draw a distinction between soft and hard paternalism. So hard paternalism is where somebody is fully informed and says, let's say, okay, I've studied the risks of what might happen to me wearing a seatbelt. I know exactly all of that information. I vividly imagine what it's like to be in an accident when you haven't been wearing a seatbelt and are worse injured. If you like, I tour the accident wards of hospitals to talk to the people who are there, and I understand their situation. But my decision is I don't want to wear the seatbelt. And if the state then says, too bad, we're going to fine you if we catch you in a car without a seatbelt, you'll get fined, that's hard paternalism. And there are some people who will accept that, but there are others who would say, no, in that case, I don't think we should prohibit that person riding without a seatbelt. It's only in the case of soft paternalism where people don't understand the risks that I defend, that somebody might say, this is not me speaking, that they defend paternalism. So you're right, the soft paternalists still have to say, what's my attitude to basically forcing people to be exposed to the information? Because the soft paternalist is saying, if you're ignorant, I'm still going to apply the law, the paternalistic law to you. And that means that the person then has to overcome their ignorance. So you could say soft paternalists are prepared to be to enforce information onto people. Just as Mill said, actually, right? I can stop you. You're jogging across the bridge, but I can say, wait, you can't go yet. I've got to tell you about the risk of the bridge collapsing. So, even that's paternalist. The guy says, I don't want to know, I just want to keep going. Mill would say, you can still stop him. And that's what the soft paternalist is saying, I suppose. You can stop people doing things in order to inform them, but Mill would say, you can't have hard paternalism.
Okay, so we need to draw this to a close. So Peter Singer is arguably the world's most famous philosopher. And for those of you who aren't philosophers, there are two marks of a good talk in philosophy. The first one is not that you go away agreeing with it, it's that you go away thinking about it. So the mark of good philosophy, which I think Peter displays is better than anyone else, is the ability to provoke you to think for yourself about these issues. And the second mark of a good talk in philosophy is there's still a lot of questions at the end, and we certainly had that today. And so I encourage you all to sort of ask Peter your questions now as we relax and have some food and wine. So Peter, thank you very much for a fantastic talk.
Thank you. Thanks everyone for watching.